Why are pancreatic cystic neoplasms easily misdiagnosed? Imagine trying to identify a specific type of cloud in a sky full of similar shapes. That's often what doctors face when diagnosing pancreatic cystic neoplasms. These cysts are tricky because they look alike on scans and share many features, making it hard to tell one from another. Many of these cysts, like mucinous cystic neoplasms or intraductal papillary mucinous neoplasms, can have similar sizes, shapes, and internal structures on imaging tests such as CT scans, MRI, or endoscopic ultrasound. This overlap can lead to confusion, and sometimes what looks like a benign cyst might actually be a precancerous or cancerous lesion. Adding to the challenge, many pancreatic cystic neoplasms do not cause noticeable symptoms. People might feel no pain or discomfort, or only vague abdominal discomfort that could be mistaken for other common issues. Because symptoms are so nonspecific, early detection becomes even more difficult. Often, these cysts are found incidentally during scans for unrelated health concerns. A common mistake is confusing these neoplasms with pseudocysts. Pseudocysts are fluid collections that usually develop after pancreatitis, and they are much more common. On imaging, pseudocysts can look very similar to cystic tumors, especially if the clinical history isn't clear. Without thorough evaluation, doctors might treat a cystic neoplasm as a pseudocyst, which can lead to inappropriate management. Current diagnostic tools also have limitations. While imaging techniques like CT scans, MRI, and endoscopic ultrasound are essential, they don't always provide definitive answers. For example, endoscopic ultrasound with fine needle aspiration can help analyze cyst fluid, but it still doesn't always clearly distinguish between benign and malignant cysts. Studies show that even with these advanced tools, misdiagnosis rates remain as high, especially for certain types like cystic neuroendocrine tumors. Another complexity is that these cysts are very diverse. Some have a low risk of turning into cancer, while others are more likely to become malignant. Sometimes, what appears to be a harmless cyst on imaging actually contains cancer cells, and vice versa. This variability makes it hard to decide whether to monitor or to operate, and it can lead to either unnecessary surgery or missed opportunities for early treatment. Plus, these cysts can change over time. They might grow slowly or suddenly change in size or appearance. A single scan might not tell the full story, so ongoing surveillance is often necessary. This evolving nature adds another layer of difficulty in making accurate diagnoses. In summary, the reason pancreatic cystic neoplasms are so often misdiagnosed is because of their similar appearances on imaging, the lack of specific symptoms, the frequent confusion with pseudocysts, and the limitations of current diagnostic methods. This makes it challenging for doctors to determine the true nature of these cysts and to decide the best course of action. Advances in biomarkers and imaging are promising, but careful evaluation and expert consultation remains essential. If you or someone you know has a pancreatic cyst, always seek advice from healthcare professionals who can provide personalized assessment and guidance based on the latest medical standards.